Good morning, everyone. Thank you so much for joining us. I am so thrilled to be on a Zoom call with some of my favorite people in the whole world, our team in Uganda. We have some really amazing stories to share with you. And while we wait for a couple more people to hop on the call, I just want to thank you from the bottom of my heart for being here with us this morning. It means so much to us. I know the team is all excited to be able to talk to you, to share stories with you, to thank you. Your support means the world to us. So earlier this year, the world was turned upside down because of COVID-19. And as an organization, similar to many organizations all over the world, we weren't sure what was going to happen. We weren't sure if we were going to continue receiving donations because of the economic crisis. We knew that trafficking was going to increase because of the vulnerabilities of people increasing around the world. We knew that the survivors in our care needed help. They needed support. We knew that people who had graduated from our program were going to be in economic crisis as well. And so we put out a call to our Willow community, and so many of you responded so generously. We were just completely moved by your support, and we want you to know the impact that your generosity has had on those in our care and on our organization. And so that is why we are here this morning, to thank you and to celebrate the impact that your generosity has had on the lives of those in our care. And to do that, you get to hear from some of our amazing, amazing team members in Uganda. A couple notes on that. So right now in Uganda, power's out. Oh, it just came back. Power just came back for our country director, as you can see. That is one of the complications of working in East Africa. Power goes on and off. We also sometimes have internet that cuts in and out. So hopefully you can just bear with us. If Joylyn needs to, she'll turn off her video so that we can at least hear her. But for now, you can see her beautiful face. And with that being said, I am going to introduce our team. We have 4 of our staff with us today. They're all going to share a little bit about who they are and how long they've been with the organization. So let's start with you, Joylyn.
Hi, everyone. I'm so excited to be on this webinar with you all, and I'm so touched for this opportunity to introduce ourselves and to talk a little bit about what a huge impact you all have made in our lives here. My name is Joylyn Edwards. I've been in Uganda for 5 years working with Willow in the capacity of country director, and I love our team to pieces, and I'm incredibly passionate about their well-being and the well-being of all the survivors in our care.
Thank you, Jo. Jennifer, why don't you go next?
Hi everyone, my name is Jennifer Rachel and I work as a Assistant Programs Director in Willow International. I've been serving in Willow for the last 5 years. I assist Lillian in overseeing the programs that runs into our aftercare shelters and also CBC programs. Thank you so much.
Thank you. And a little background on Jennifer. She started with us as a case manager. She's a social worker by trade, and she did such a fantastic job joining our team and has really led a lot of case management efforts that she was promoted at the end of last year. And next we're going to hear from Millie.
Hi everyone, my name is Millie. I've worked with Willow for the last 4 years. I work as a shelter manager. Basically, my role is to ensure the well-being of clients who are in our aftercare program. Thank you.
Thank you, Millie. And we're going to move the computer over so we can see Lillian. There we go. Hi, Lillian.
Hi, Kelsey, and hi to all those who are watching us. My name is Lillian Ayala, and I serve as the Programs Director at Willow International. I've served with Willow for about now 8 years. And I'm really happy to be here. Thank you.
Thank you. And a huge thank you to all of you for joining us. We know it's nighttime there, and we appreciate you working late so that we can hear from you. So next, Joy Lynn is going to give us an update over the populations that were impacted by your generosity and how our team responded to COVID-19.
Thank you, Kelsey. I wanted to highlight the 3 specific populations that we serve in regards to aftercare. So we serve a community-based care participants who exit from exploitation and then have a safe place in the community where they can live and get support from their community, all the while going through our aftercare programs. The population has a number of participants. Lillian and JR will correct me if I'm wrong on that. The second one is, of course, our residential aftercare program. So this is a program where we provide the residential support that really vulnerable participants may need. Not everybody needs residential care because they would have a safe place in the community where they can go and complete their service plan through. So the residential aftercare shelters are for the most vulnerable survivors and also for children who, as we all know, are the most vulnerable in our populations. This third one is the graduates. Now we have a really unique relationship with our participants, which includes extensive follow-up care after a person graduates from our program. And this is because once they've received this emotional support, therapeutic support, psychosocial support, and all of the other services that we provide, it can be a little bit difficult to reintegrate into the community where they might not have the kind of support that they get in our program. So we ensure that we do a phased approach into the follow-ups to ensure that they are really thriving in their home communities that they were reintegrated to. So I wanted to highlight those 3 populations because I wanted to talk to you about how incredibly devastating this lockdown was for 2 particular populations, our community-based care clients and our graduates who have been reintegrated into the program. So it was a phased approach where these markets were closed, and then public transportation stopped, and then all transportation stopped. And why that's important to note is that if the markets had closed, we would still be able to bring supplies to the participants who were vulnerable and suffering in the community. However, because transport also shut down, we were really in a hopeless place where it was very difficult for us to even get supplies to these participants who were in the very far villages and unable to access funds to feed their family. And a lot of these participants live with multiple children in the deep villages, and they relied on these small businesses, these selling vegetables, hair salons, tailoring that required direct interaction with people in order to make a profit. And once those were closed, then all of their income, all of their livelihoods were cut off very fast. And it would have been different if they had had a lot of time to save what little they could. But because this lockdown happened so quickly and so severely, it was very difficult for them to save, and that put them in an incredibly vulnerable situation. We were getting phone call after phone call after phone call of asking what to do. They were really nervous because the government had said that they would provide food support, but the logistics of that was not thought through. And so a lot of these very vulnerable participants who had no income, no food to feed their children, and the government had not given them the food assistance, they were calling us saying, I'm watching my children starve to death. What can you help me? And JR and Lillian and the team will tell you that we received phone call after phone call after phone call. And us here in Uganda, we're trying to mobilize as fast as possible. How do we get the services that they need? How do we give them the support as quickly as they need it? All the while ensuring that we are also following the guidelines that the government had put into place. It was a very desperate time for us. And when we received the emergency funding, we were able to mobilize quickly and give this support directly to the participants, and they were able to feed their families. And so this funding that you also generously contributed to was a matter between life and death for our participants, actual life and actual death. So it was so incredibly impactful, and we are so incredibly grateful as a team at Willow for the rapid response, because it was incredibly dire here. Thank you.
And Joylyn, we are so thankful for you and the whole team, because all of us wanted to do something here stateside. I know everyone on the call cares so much about the team and the participants, and we know how hard you work. So thank you for mobilizing the team and pivoting the programs. I also want to note that Joylyn and the entire team moved all of their services into telephone services. So they didn't leave the participants high and dry without the counseling, without someone to talk to. In addition to providing food and money for medical attention, they also provided phone counseling and helped talk them through the different traumas that were coming up as a result of being locked down. Joe, could you also talk to us about how you responded with the shelters and how the staff really stepped up so that we could keep the shelters operating?
Absolutely. So I just wanted to thank the shelter team for their incredible response, because they worked nonstop. We had to do a complete lockdown of the shelters, which means that the residential staff who had usually worked on rotation would have to be in the shelters 24 hours a day, 7 days a week for 3 months. And so we tried to work out, me and the whole team tried to work out a system where they were able to take breaks, all the while maintaining safety within the shelter. And so that is something that Millie really spearheaded as well. And this also required us to do programs in order to still execute the program, everything done online and over video. We did online video yoga videos for the yoga program. We did group counseling over FaceTime and over Zoom and Skype. And so we were constantly in contact to ensure that we could still do some of the program. But it wouldn't have been possible if we didn't have such an amazing residential team who were always available and who were always willing to do the programs. And they really stepped up in this time, and they worked so incredibly hard, and we're so grateful for them.
Yes, we are. Truly, truly an incredible sacrifice to make, and we're so grateful for our team. Next, Lillian is going to move the laptop over so we can see her face, and she is going to share the numeric impact, the number of lives that were impacted through our emergency fund campaign.
Thank you very much, Kelsey. And well, 67 survivors of trafficking. Thank you. All right, 67 survivors of trafficking were provided care in our residential aftercare facility or program, and 205 survivors of trafficking and their children were also supported in our community basic care program. And during this lockdown, we managed to receive 50 survivors of trafficking who had been identified by our partners, and they were immediately provided with support and care. And out of the 50, 32 were children and 18 of those were the adults. Overall, we have been able to reach out to 2,232 lives. Of course, that has been we've been able to do that because of your generosity and your support. We thank you so, so, so much. May the God bless you.
Thank you, Lillian. Now we're going to move on to sharing some stories of lives that were impacted, so that you can really get a feeling of what this was like for the survivors in our care and how your generosity supported them through this difficult time. As you heard Joylyn sharing, Millie was in our shelters for 3 months, overseeing programs, making sure that everyone was safe. Just a true amazing sacrifice. And she's going to share 2 stories with us today of children who were impacted. Thank you, Millie.
Thank you so much, Kelsey. I'm glad to share 2 stories with you, just to let you know how the lives of the participants have been impacted by your generosity. One, I will just say a name. One of the participants is called Linda. Linda is in our residential aftercare program. She's 15 years old. She was trafficked by a German perpetrator domestically for sexual exploitation. She was later rescued by the government officials and brought into our aftercare program. But because of what she went through, she got a mental breakdown. It was being managed before because she was on medication and in school. Unfortunately, the lockdown highly triggered it, because she was kept in one place, being locked up in one place, no school, and also all the worries. It worsened, the situation worsened. She became so sensitive. She needed a lot of care. She needed medication. It was kind of a hard time for us. But thank you so, so much for the Emergency Fund campaign, because even during that difficult time, we were able to get her medication. We were able to keep her at the shelter because of the emergency funding, the shelters were kept running. She was able to stay at the shelter, get the medication, and right now I can say that she is improving. She has got all the support she needs, the care, the counseling, the medication, and the safe environment where she's living. And for sure, without your support, we wouldn't have got this. So thank you so much for supporting us, even during the difficult time. You've kept our shelters open and running, our programs kept on running. I greatly thank you so much. That's all about Linda.
That's good.
Next is Tina. Tina is 22 years old, also in our residential aftercare program. She's a single mother of 1. She was trafficked to Kenya for labor, but ended up being sexually exploited at the place where she was working as a maid. She was always sexually abused until when she got a chance to escape and looked for help from the police in Kenya. So the police in Kenya referred her to HART. HART is an NGO in Kenya who connected her to Willow International. She came to our care. She joined our residential aftercare program. She was enrolled into formal education, and this made her very, very happy because she has a dream of being a doctor. She has a dream of being a doctor. Unfortunately, still, the outbreak of COVID was a very big blow to her because she became so worried, she became so anxious, thinking that Willow was closing very soon. Just because COVID affected the whole world. So what came to their minds first was that Willow is closing the shelters, and that worried her so much. But still, even during that time, you were able to support us through the emergency fund campaign. We received funds to help her stay in the shelter. We were able to get learning materials for her. We were able to do homeschooling and to keep her in the shelter, to have food to eat, to have where to sleep, and all that she needs. This really raised her hope, though her hope was dying. And she became happy. She's so grateful. Right now, she's busy reading her books, hoping to achieve her dream. And she's so, so, so happy. I really thank you so much for the great support towards us, towards the clients in our care, because you've made it possible for them to remain in the shelters, to get what they need, and still to keep their dreams alive. So I greatly thank you so much.
That's amazing. Thank you so much, Millie. Next, we're going to go to Jennifer, who's going to share a story with us as well.
All right, thank you so much, Kelsey, and thank you everyone who is listening to us. I would like to share with you how impactful your giving has changed and supported the lives of the survivors in our care. I'm going to share about Remy. Remy is a 20-year-old lady who was trafficked transnationally to Saudi Arabia, and she was exploited for a period of over 1.5 years. During her time of exploitation in Saudi Arabia, she was first trafficked for labor, but later on, the sons of the family where she was working in used to sexually abuse her. They would sleep with her at any time that they wanted to, until one day when she tried to resist, as a punishment for her resisting the act. These sons in the family, there were 4 of them, they inserted sticks into her private part as a way of punishing her, and some of the sticks broke and remained in her private part. She began suffering and her health started deteriorating so badly. She was later on identified by a Good Samaritan who later rescued her and referred her to Willow International for rehabilitation. When she came into our care, she had lost a lot of weight. She wasn't in her rightful mindset. She was so depressed, but we took her into our care and started providing her with therapy and also medication. She stayed in our residential aftercare program for over 1 year. But during this time that she was staying with us in our aftercare program, she showed a passion of like being a hairdresser. And Willow supported her in that area, took her to school to attain her goal. Like she learned a skill on hairdressing. She later on graduated from hairdressing in school and then started up her own salon with the support of Willow, who provided her with the startup capital. She was such a passionate woman who wanted, as a way of giving back to the community, wanted like to also give an opportunity for people of her who may want to learn to also come and learn from her salon. So before the lockdown, as a way of expanding on her salon and her business and creating opportunities for other people to come and learn from her, she got a loan to add on to things into her salon and create a center where people could come and also train, and so that she can give back to the community. She had just started paying back the loan. Unfortunately, that was the time when we got into a lockdown. It was a bad timing for her. So we got into a lockdown and everything came to a standstill for her. The salons were closed, no transaction, no business. And as if that was not enough, as we were in a lockdown, thieves also broke into her salon and they stole the things that she had just purchased. So she was stuck with rent that was accumulating. Her things were stolen from the salon, and then she's here struggling to survive. But when we had sessions with her, we were able to discuss it over with the management. And thank you so much for your generosity. Through the emergency fund campaign, Remy was able to, her rent was able to be covered. We were able to cover all her rent arrears that she had. We were able to give her fund to rebuild her business. And she was so happy. Today, with the lifting of the lockdown on salons, Remy is a very happy person. She's back onto business. She has so far enrolled 4 ladies who are getting training from her salon. And all this is because of your support. And I must say, we are really, really, really grateful. As a team from Willow, we cannot stop thanking you. Thank you so much for the big heart that you have. May the Almighty God bless you so much.
Thank you, JR. Yeah, that story really reveals how a survivor can work so hard to rebuild their life, and something small can just send them back to being in that vulnerable place that led them to be exploited or potentially trafficked in the first place. And it's why at Willow, we stick with survivors for a long time. We continue following up, we continue supporting them, providing a peer support group for them to come to, because we want to make sure that they're stable after leaving our aftercare program. Lillian, do you have a story for us as well?
Yeah. Right. Well, allow me to share this story. This is a story about Priscilla. Priscilla is 22 years old. She is a single mother of 4 children now. And she was trafficked to Thailand for purposes of sexual exploitation. When she was identified by Nightlight, usually as organizations, we conduct online polls where survivors get to share what they expect and some of the things that they have gone through, and then also getting to reality what they should really find on the ground. So we got to know that she was also HIV positive, and she was really open, and of course that meant that she would actually be started on art as soon as possible. So she was interested in community basic care program, and when she reached in Uganda, of course the uncle was there with us to receive her. And the beauty with our services is that we don't only look at what the survivor is interested in, but we give different things that the survivors can usually grow and also be able to compete with other people who are there in the community. So some of the things that were provided to her included, of course, counseling, medical care, basic life skills, entrepreneurship skills, name them. And of course, she progressed very well. And then we were able to provide her with a startup capital. Unfortunately, during the lockdown, of course, everyone was trying to cling on whatever food stuff that they had in stock. Since her business was specifically in general merchandise, they ate everything that they had and the family that she has. And then, of course, time came where she could not access even a bar of salt or a kilo or a quarter of sugar. And I'm very happy to say that with your support, we were able to provide the basic needs that she needed. And this also went overboard to even provide her with the medical care, not only for her, but to also the children. Because you find that it was really very hard for them to access health facilities, even the basic things that someone needs. And of course, right now, she has been provided with some funds to actually put back her business. Of course, it had been hit very badly with COVID, but right now her business is growing and it is really looking very nice, or it's really working very, very well. And we wouldn't have done that if it wasn't with your support. So this is just a few voices trying to appreciate your generosity, your support. And you know what? It is really not into how much you give. For you, you might think that it is very small, or for some people, they feel it's very big, but you don't know how much it does in one's life. Here in Africa, we've been begging for the government to provide some supplies like posho or corn flour, and some vulnerable families have not. However, all our survivors, those in the shelters, those in the community basic care program, and those who had graduated from our program have all been catered for, and they feel very much supported. And we say, thank you very much.
Perfectly said, Lillian. I couldn't agree with you more. So now we want to move on to a question and answer section of the call. So for those of you listening in, feel free to utilize the chat function on the Zoom app. You can type in your questions there if you have any questions, and I will direct them to the staff. As we wait for questions to come in, I have a question for you guys. You can choose who wants to answer it. All around the world, we're talking about how COVID-19 is increasing trafficking, that we're expecting to see more and more people being trafficked as a result of this. Could you share with us why that is and why it's so important for anti-trafficking organizations to continue their work?
Thank you so much, Kelsey, for that question.
I'd be very happy to address this question. And then if Lillian and the team has anything else to add, please feel free to jump in and add as well. But what we're seeing is that, especially here, trafficking a lot of times is a direct result of vulnerability and poverty in the community. So because so many businesses were hit severely, everyone was hit severely, not even businesses, but these small markets and these transportation, these motorcycle drivers, and every single sector was hit. It created such intense vulnerability, and the poverty level skyrocketed in an already vulnerable country where the youth unemployment rate is astronomical. Someone can check the numbers, but I believe it's over 75%. So trafficking really thrives when people are desperate, and when they are in a situation where they don't have any other option, they're willing to look for the chance that things might be better. somewhere else. And so that puts them in a vulnerable position, an easy prey for traffickers to manipulate and to promise greener pastures and just basic, basic needs being met. And this also really increases the risk of children being trafficked. I mean, adults are very vulnerable, but children are the most vulnerable at this point, because children here, there's a huge financial implication that comes with having more children. Schools are expensive, feeding is expensive, medical care can be expensive, especially when you have these severe diseases like malaria and typhoid and whatnot. So someone might be willing to unknowingly give their child to somebody who promised education or even basic care, and in fact uses that child for exploitation. So we're really anticipating a high number of child trafficking cases within Uganda, of children from the deep villages being trafficked into other regions, and then in the East Africa region as well. And so this comes from also our partner organization. It's a huge concern for the anti-trafficking organizations in Uganda. And I'll stop there.
Thank you, Jo. Lillian, did you want to add something to that? Oh, you're on mute, Lil. There we go.
Thank you so much, Jo. I think Jo has really...
Oh, Lil, I think we need you to lean a little bit closer so we can hear you. Thank you.
Thank you. I think Jaylene has brought every element out. Right now, especially children are the ones who are mostly vulnerable. And looking at how everyone has really been hit, of course, the children are now the ones who are getting the effect of COVID more, because we're seeing more children working as maids, and then the families are supported with some food, and children are the ones again who are now begging on the streets. They're trying to sell things on the streets, and most of them, you'll find that it is not easy for so many people to really right now give support. Right now, some organizations even closed. So everything gets back to the children. And when you look at the general state of the country as well, it is not so strong enough to support the children who are now becoming the victims. Yeah.
Thank you, Lillian. We have a question from, oh, did you want to add something, Millie?
Yes.
Please do.
Just to add on, because people's business were hit so much, now in families there's violence and children are at home because the schools were closed. So the violence at home is also contributing to forcing children to look for their ways out. So they will end up being trafficked.
Mm. Thank you, Millie. It's heartbreaking. We have a really nice question from our dear friend, Sarah Truebridge, who has been helping our organization through the lockdown. She is a donor and a friend and a volunteer. She worked with Millie and our shelter team to establish a program called Word of the Week that helped survivors process what they were feeling in a way that was positive and built strength and resilience and community. And Sarah has a question for the team in Uganda. She's asking, how are you ladies taking care of yourselves? What are you doing to care for you during this difficult time? Maybe we'll start with the team, Jenny and Millie and Lillian. Do any of you want to share?
Well, thank you so much, Sarah. Good to see you online and to hear from you long time. As a team from Uganda, of course, we are observing the SOP, the standard operative practices that has been put in place by Ministry of Health. And when the lockdown was effected, we saw ourselves getting into doing work electronically. We do our sessions from home, like we try to keep a distance from as much as possible, not to like expose ourselves. And then we always make sure that we are wearing masks. We make sure that we are sanitizing and washing our hands like we are practically doing everything that we can to really keep ourselves safe. And yeah, we have been safe, thank God.
During the lockdown, sorry.
No, Millie, go ahead. Share how you took care of that. Your feedback is especially interesting to us because you were in the shelter for 3 months without leaving. So what did you do to care for yourself during that time?
During that time, for sure, it was a stressful time at first, because being in one place for 3 months, it was not easy. But at the shelter, we decided, one, to do exercises every day. So we were working out every day, all of us together. It became fun. We had the girls, the staff, all of us in the evening, we worked out. It was fun. And then we started eating healthy because we didn't want to grow so fat, and we started eating healthy. We could bring in ideas like we can eat this, don't eat this. Now, I personally, I stopped eating meat during the lockdown. I was doing vegetables so much. I was doing lemon tea so much. It really kept me beautiful and happy. The exercises kept me very happy and of a good size. Yeah.
You look beautiful, and we have comments in the chat also saying that you look beautiful, so it worked. Lillian, how about you? You were managing a team of case managers who all had to change the way that they were doing their work. That sounds stressful.
Yeah, it's really got very stressful because, of course, much as I was not always at the shelter, especially the first 3 months, you always had to find out what the mentors were doing, what programs can be impactful in the lives of the children, in that they are not stressed or worried. And of course, even the case managers themselves, because even being on telephones or going telegraph, I mean, it is really also stressful somehow. And well, as an individual, I decided to go for counseling. And of course, I would meet with my colleagues and kind of pour out whatever that was within me. And then, of course, this helped me to release myself and to kind of create space within me. And again, just like Millie has shared, I also got into exercising, because I mean, we were not supposed to move outside. Of course, the president also shared with us how we can do exercise within our sitting rooms, and it was very funny, you know. So we had to just utilize all the resources and everything that can help us be in shape, be active and productive. And then, of course, to my colleagues, of course, even giving them inspiring information or, you know, words or something that can help someone move again another week or another mile. Yeah. But we wouldn't have done that if we were not receiving any support from you people. Because right now, as I speak, Willow has a counselor or a team of counselors who are there to provide counseling to the staff. So many staff are actually going in for counseling, showing that, you know, something has really been going on. You know, being always at home, this is not something that we had been used to. And I mean, it has really helped us to be positive and also be able to provide care for those whom we love.
Thank you, Lillian. Joylyn, do you want to share with us what you did to care for yourself?
Yes, actually, I did a little bit of an unconventional approach. I started a 30-day of art or creativity project in June. So I said to myself, okay, every day for 30 days, I'm going to do something creative. I'm going to do a little painting or a little drawing or a little something, just to kind of expand that creativity. We also wanted to highlight important, and so even post initiative for us to ensure that the staff at the facility, that their counseling is a priority to the management as well.
Thank you, Jo. Another question we have for you is from another dear friend, Stephanie Ford. We love you, Stephanie. She's asking, what do you look forward to doing when we get through this and we're on the other side of COVID? Jenny, Millie, Lillian, do you want to answer that one? You're muted. You got to come off mute. There we
Yes.
go.
Yeah. Oh, a lot of things. You know, the lockdown or the COVID has restricted us a lot. I can't wait to physically meet the clients and practice the thing that we know how to do best and get back to our normal life of socializing and hugging and, like, you know, that freedom that we always have when we are working like together. Right now, everything is restricted. We need to follow, and it feels like it is not so much a normal culture in us, but yet we have to go along with it. I really look forward to receiving more survivors, because at the end of all this, I know there's so many who are stuck outside there and they really need the help. And yet right now they cannot get it. Yes, preparing myself to really receive them and be able to support them so that they can recover and heal. And also to hug all of you if you can never come to Uganda.
Oh my goodness, don't you miss hugging? It's so weird not to hug people.
Miss so much hugging people. Now we only have Jo, and we also have to keep her safe. So like sometimes you're like, I feel like hugging you, but I have to keep you safe. So like, yeah.
You know, we feel that here too. Millie and Lillian, what do you have something you look forward to?
Yeah. One, I can't wait to hear that you're coming to Uganda, because right now it looks like a dream. Really, I don't know whether you will ever come back. So I really want this to get done, and here you say that you're coming to visit us. I can't wait to see other programs going on, like the prevention program, that project, because we were so ready to take the awareness to different places, and also the plans we had of taking help to other districts, because we had that plan. So I can't wait to see this COVID done, and we kick off on our programs. We had a plan of opening up another shelter, all that. I can't wait to see all being worked on. So right now we are like some programs are on pause. So I can't wait to really see that all our programs, all our plans are being worked on and implemented.
Wow. Well, this is really a good question. And personally, as an individual, well, I look forward to so many things. One, COVID really showed us how we can work, even when we are not present, or even when we are not at the shelters. So this means a lot to develop in terms of different tools that can help us be able to reach out to our clients, even when we cannot be where they are. Because I understand when I look at the CBC program, we have been going there to see them, like the case managers have been visiting them. and the vice versa. But right now, during this COVID, it has showed us that we need to actually get a better way of giving the services, even when we are not there. Now, this calls a lot for different tools, curriculums, things that can really be understandable in our African tradition, in that, again, it doesn't create a sense of not being productive or useful to the people that we serve. And then the other thing that I'm also looking at, there's so many things that had been put on hold. For example, so many things are happening when you look at the legal department. Of course, our act is being replaced by another law. So there are so many things that need to be worked on, and that can only happen if everything goes back to normal or everything stabilizes, in that our voice can be heard, and then we're able to advocate for the rights and what is really doable and realistic in the lives of the survivors. When it comes to prevention, like we've already shared with you, so many things have actually shown how children are vulnerable and how they are the worst now, like they're the most vulnerable. So what does this mean? Of course, families have been torn apart, and that means that a lot of work needs to be done. And this means prevention, going an extra mile of going to the remote areas and conducting sensitization activities from the grassroots level to the leadership, and then seeing that at least there is a decrease in the number of survivors of trafficking and actually other forms of violence or abuse against children. So this actually does not mean that other partners are going to be left out. It means that we need to network with as many organizations as possible in order for us to put every vice that violates any human rights or any thing in line with children to zero. Yeah, thank you.
Thank you, team. I have another really relevant question to some of the things you just shared, Lillian. Rick has asked, because it might be some time before we have a COVID vaccine, what are the most important things that our team needs to continue providing services in as normal a way as possible? And I'll start answering, and then if you guys want to add anything. I think the first thing is technology. So a lot of our services have had to move to online case management services. A lot of our programs have adapted. Our trauma healing yoga program moved to Zoom and recordings. And so more technology, updated equipment would be really helpful for us, so that our team has fast internet devices that work and maintain a charge for when power outages happen, so that we can continue adapting to this new normal of distance services. I think in addition to that, I would add the ways that we've already been supported through monetary donations help us to continue providing these services. I thought it was so just enlightening, the story that Millie shared, that even the survivors in the program feel anxious. They know that they're in a program that operates off of donations. It's not like here in the US where you have social services, you're not really worried about that going away. They understand that we rely on donations and grants to keep these programs running. And I know that our team is reassuring them and comforting them that we're there for them. We're not going to leave them stranded. But truly, we do need donations. We need people to continue supporting us so that we can keep the shelters open, so that our team can continue providing case management services to the graduates and those in community-based care. And along with that, we need people to share the message of what we're doing. We need them to share Willow with their friends, their coworkers, their community, so that more people can join us in supporting survivors. And I will plug, we have an event coming up. Info will be going out soon on October 22nd. It will be a virtual event, and that's a great way for you to share Willow with your community. They can join us from the comfort of their own home. They can be in their jammies. They can watch, they can learn about our work and make a donation or share with others. And we have a couple more minutes, so I'll turn that question over to the team in case I missed anything. What else do you need to continue providing services?
I think those are the major points that I see. Like Kelsey said, you know, technology is a huge because there are so many. It is a hard climate for devices, and the devices we have, which are functioning, but there's a lot of issues that come along with them. So even providing you know, tech support as well would also be really useful. So I want to re-emphasize.
Thank you, Joe. You had something, Lillian?
I think the other thing that we need, of course,
Oh, Lil, can you come a little bit closer? Thank you.
I think the other thing that we need at Willow.
Oh, sorry, we still can't hear you, Lil. A little closer.
The other thing that we need is the emergency facility, because right now we are receiving so many survivors of trafficking, and of course we don't want to put the rest of the survivors at risk. So we need probably a place that can be isolated, whereby say someone can be quarantined for the minimum number of days that have been recommended by the Ministry of Health. And then she's rejoined or joined with the other team after the right time. Because right now everything is really, I should say it's up to the organization, and yet the need is really big. So we need that facility for us to be able to do our work well. Thank you.
Thank you, Lillian. And thank you to everybody who joined our call. We want you to know how grateful we are for you. As you've heard from these stories and from the feedback from the team in Uganda, your donations, your support have truly saved lives. Joylyn made that point so clear in the beginning. For many people in our care, it was a difference between life and death, getting food and medicine, and we're so grateful. I know many organizations during this time have struggled. Many nonprofits, as the team have shared in Uganda, have closed down because they haven't been able to raise enough funds to keep their doors open. And we feel so loved and supported by our Willow community. For all of you who have given donations, who have shared Willow with your friends, who have posted on social media so that other people would learn about us, it means the world to us. It truly is saving lives in Uganda. And as you heard from our team, I'm just so inspired by you guys. When we asked you the question, what do you look forward to after COVID? You didn't say going on a tropical vacation. You didn't say getting a massage. All you talked about was being able to do the work that you do every day. And I could cry just hearing that, because you are so selfless and so passionate. And we thank you. Thank you so much for the work that you do, for sticking with us in Uganda during a pandemic, for staying in a shelter for 3 months, Millie. We are so grateful. I know if I'm getting things in the chat here that are also thanking you guys, sending you love, appreciating all that you do. So please send our love to the rest of the 50-something staff we have in Uganda. Tell them that they're loved by us, and we're very thankful for them. All right, well, thank you again for joining us. We hope you all have a wonderful day, and to you in Uganda, a wonderful night.
Yeah. Thank you.
Bye.
Bye.